Hi, my name is Dr. Karan Shetty. Welcome to my YouTube channel. Please like and subscribe for more educational content on plastic surgery and dermatology.
Inspired you to start your journey in plastic surgery?
So, plastic surgery, I've always wanted to be a doctor as far as I can remember. But plastic surgery in general, I think when I was doing my general surgery, I realized we had some burns patients. So, there was a burns unit, and I think treating burns patients and getting them, saving their lives, sending them home, rehabilitating them was, I think, one of the first sparks which said that yes, I can do plastic surgery. So I think that was my first impression of plastic surgery, and I think plastic surgery entails everything. When I checked, after your general surgery, you can do one of five things, which is neurosurgery, which is the brain, cardiac, cancer, GI, urology, and plastic surgery. So this was one of those fields where you can do from head to toe, which means you can start. We used to do cleft lips on children, and then in the afternoon you can do like a skin graft on the leg, and then you can do like a cosmetic procedure, then you can do something with burns. So it seemed like you can do many things rather than just doing one system. So I think that is where I felt that plastic surgery was the best possible field. So even though I would say majority of our work is cosmetic surgery, we still do a lot of burns, we still do a lot of trauma and reconstructive work, but aesthetic surgery remains our main focus.
If you weren't a plastic surgeon, what would you have been?
What would I be? I would say I might have studied for the IAS. Second thing is, since childhood, I think we've been exposed to a lot of movies, especially Hindi and English movies. So maybe direction or cinematography is something I would have looked at.
What's the funniest misconception that people have about plastic surgery?
The biggest misconception that people have about plastic surgery is that one is that we do only cosmetic surgery. We don't. We do a whole lot of things, like I said, related to trauma, reconstruction, cancer reconstruction, burns. And the second misconception is that a lot of people think that plastic surgery has to do only with cosmetic surgery or only with the skin. So there are multiple things that we do. And I think because of the emergence of cosmetic surgery in the last 10 years, where the number of people doing cosmetic surgery has increased a lot in India compared to 10 years back, and it will just keep increasing. So I think it is equated to cosmetic surgery, which is a big misconception.
Which one cosmetic procedure do you think is underrated?
Underrated. Interesting. I think the power of a tummy tuck is underrated, or women think that they shouldn't get it done, or they're scared to get it done. But I think the transformation that you see with a tummy tuck, or the transformation in terms of the confidence that people have with the tummy tuck, is incredible. You can never find a change or a result like that, where they just go from that to that, and they're extremely confident after that.
What do you feel about social media filters and their impact on beauty standards?
Social media filters are what have given unrealistic expectations to the aesthetic industry, which means people want to look like a filter, which is practically impossible. Filters are designed to filter out the blemishes and the imperfections that you have. So I think equating a filter to having a real skin and running after a result like that is a big problem. So I think you should have realistic expectations of your treatments.
What's the most common request you get from patients?
Make it less painful, or make the procedure less painful. And most of the time, all these procedures don't have too much pain. With the kind of anesthesia, with the kind of painkillers that we have, the most common request is that please make sure my post recovery period is simpler. So most of the time it's anxiety that they build up in their mind, and because of which, they make a mountain out of a mole, and then after the procedure they realize it's so much simpler. So I think that is one of the things that we want to change.